Okay, good morning, everybody. Today we're going to go over common ailments in the elderly, as you can see. What I found when I was researching this topic was that there's just so much depth to the various ailments we're going to go over. And so I basically ended up doing a bit more of broad coverage over it, just basically going over the basics of each thing. And then there's a couple of these topics I think that I might end up doing a full hour on next time I do a webinar, just because I found there was so much to them. So let's just go through things. I think it'll give you a good understanding of the basics of some of these, okay? So Alzheimer's versus dementia. Now, this is one of those things that I learned there was so much more to it than I ever really thought. So let's see if any of this is new to you guys, because I made a bit of an error in the way that I thought about dementia. So let's find out about what my error was. So dementia is actually not a specific disease, which is what part of my mistake was. Dementia is actually a combination of symptoms and has different causes. So dementia itself is really more of a symptom of another disease rather than a disease itself, which was really a surprise to me, actually. So possible causes can include hypothyroid, vitamin deficiencies, certain medications, Lewy body, Parkinson disease, Alzheimer's disease. The list really went on and on. It was quite in depth. And so this is a topic I think I may do in the future, because it would be very easy to do an hour just on the different causes of dementia. So the other thing I learned is that the prognoses for this can range between complete reversal of symptoms depending on the cause to eventual death, again, depending on the cause. So if your cause was a hypothyroid, vitamin deficiency, certain medications, and they can catch it soon enough and treat it, then your the dementia can be reversed, or at least the damage limited, which was really surprising to me as well. Now, when it comes to Alzheimer's disease, this is actually a specific disease. It's a progressive disease, and it causes a form of dementia, Alzheimer's dementia. The most common form of dementia is Alzheimer's dementia, and it comprises 60 to 70% of dementia cases, which is, I was also shocked by that. It's caused by plaques in the brain tissue, which interfere with normal brain processes. And as the brain cells degenerate and die, it causes shrinkage of the brain and eventually death, which is very sad. It is a very unfortunate disease. But again, dementia is a symptom of Alzheimer's, or something that Alzheimer's causes. So dementia is more often short-term memory loss. Now with Alzheimer's disease, it does eventually turn into short-term and long-term. With dementia, you're often unable to recognize friends or family. You'll have difficulty finding words. So you might be saying a sentence and meaning to say the word kettle and then just forgetting completely what the word was. You can maybe picture what a kettle is, but can't think of what it's called. The patient might not even be aware that they're having an issue, but often the friends and family will notice. And then the range of symptoms vary depending on the cause of the dementia. With Alzheimer's, there's cognitive and functional impairment. There can be, now it's not all of these necessarily, and it may be more and more of these symptoms as it progresses, but decision-making abilities, difficulty performing tasks, progressive memory loss, confusion, loss of direction, so you might be out for a walk around the block that you do every day and suddenly become lost, decreasing coordination and mobility. They may appear apathetic or have a flat affect, so often if you see someone's the patient's face just might be very, there's no emotion on it sometimes. There could be possible behavioral changes which are really out of character for that person. They might be really restless, like pacing, or just not able to relax. They might hide things. I have known people I know with it to steal things, and they might have emotional or physical outbursts. And yes, Sandra's saying it's what happened when her mom passed away and it's horrible. I'm very sorry, Sandra. And it's true that a lot of the things I might go over today might be difficult for some of you because these are sadly common things that happen to seniors. So a lot of us will be familiar with some of these, and I'm sorry if I touch any nerves for anybody. Okay, so I'm just going to go through a quick little quiz. Okay, is dementia a disease or is it a symptom caused by another disease? You can just type in, Victoria says a symptom. Anybody else? Just feel to type it into the chat box. There's going to be a little quiz. Joanne says symptom. Cheryl, great, perfect. Yep. So dementia is not a specific disease itself, but it's caused by other disorders or diseases. Can dementia ever be reversed? Perfect. Everybody's saying yes. Dementia caused by medication, hypothyroid, or vitamin deficiency may be reversible with treatment or medication adjustment. Is Alzheimer's disease fatal? Yes. Yeah, it's a progressive disease which can cause fatality. All right, moving on to arthritis. So we're going to go into a couple different kinds. So first being rheumatoid arthritis. So here are some points about rheumatoid arthritis. It is an autoimmune disorder, meaning that the body is mistakenly attacking itself and causing an inflammatory response. It's chronic inflammation of the joints and other areas of the body. It tends to have flare-ups and periods of remission, which is what often sets it apart from other types of arthritis. It's ups and downs with this disorder. The trigger is unknown. So the cause of rheumatoid arthritis, the initial start of it, they're really not sure exactly what starts it, and there is no cure for it. 80% of the patients with rheumatoid arthritis have rheumatoid factors, particularly IgM, which can be detected with a blood test. So if you're doing a report and they're talking about IgM levels or positive rheumatoid factors, this may be very well what they're looking for is rheumatoid arthritis. Excuse me. It's more common in women. It is the inflammation of the synovial membrane causing swelling of joints. So I do have a diagram coming up so we can see the synovial membrane. And what happens is eventually the synovial membrane thickens into a pannus. Now pannus is an abnormal tissue that clings to the articular surface. So we'll get into that in a second too. And then over time, the joints form scar tissue, and then there's a loss of the joint space, and then possible fusing of bones called ankylosis. And again, the diagram will show that a little bit better. So here we go. There's a healthy joint. Let's just pretend this is a finger. So we've got your knuckle here. So we've got one bone and the other bone. The capsule around it, the inside of that capsule is a synovial membrane. We have the cartilage coating each ends of the bones, and then we have the synovial fluid in between the bones. So you start with the synovial membrane being inflamed and it thickens up. The bones and the cartilage start to erode. So we've got an inflammatory process going on. The body is basically attacking itself. So the cartilage is eventually, it just disappears, and then this pannus forms, which is the abnormal tissue, and it's think of it as like a sticky tissue, like a scar tissue, and it's sticking to everything that is in there. And then there can be exposure of the bones, and the bones will be pitted because they're starting to erode. And then again, as the inflammatory response goes on, your body wants to lay down fibrous connective tissue. Think of it as fibrin or scar tissue. And then as that progresses, your bones start to remodel. So think of it like very similar to if you break a bone and it remodels itself, but this is just the scar tissue and inflammatory response just going overboard, and your bones can eventually fuse. So if you see somebody with the hands that are deformed shapes, that is very likely what's going on is rheumatoid arthritis. So here are some of those deformities that are really common, and you will hear these words quite a bit in your reports, I'm sure. So this is a very late stage of rheumatoid arthritis. There's been a lot of bone fusion remodeling going on. So ulnar deviation, so your hand on your wrist points more towards the side of your little finger. Boutonniere deformities, swan neck deformities, Z-shaped thumb here, and MCP subluxation, which is here. So these are really common terms that you will hear for sure in the future. So osteoarthritis, we've got the diagram already, but let's go over some points. This is the most common type of arthritis, chronic type of arthritis, I should say. It's considered non-inflammatory type of arthritis, and it's caused by degeneration over time. So instead of being caused by your body attacking itself and causing an inflammatory response, it's just wear and tear over time, just joints rubbing, moving together over years. If you play a lot of sports, people tend to get arthritis a lot sooner. It is more prominent weight-bearing joints, so ankles, knees, etc. The ones that really take a lot of our weight and wear and tear over time. There's degeneration of the meniscus, which is interesting in this diagram of the knee. They don't actually show the meniscus. There really should be a pad on either side here. The articular cartilage, which is the white that you're seeing here, and that does eventually wear down and lead to bone on bone. So if you were to take your two hands and make fists and then put your fists together like a fist bump, and imagine that that's your knee, and in between there you normally have sponge, which would be your meniscus, which is missing in this diagram. And if you just picture, rubbing those knuckles together, your fists together over time, years and years and years of wear. And then the meniscus will eventually lose fluid over time. They will become thin over time. And then as you're rubbing on them, they'll just degenerate and just disappear eventually. And then you'll end up with the bone on the bone, just touching each other with no padding in between, which is incredibly painful. And this is also known as degenerative joint disease. So again, here's our healthy joint with the synovial membrane. This is more of a finger, not a knee, because again, there's no meniscus there. So with rheumatoid arthritis, there's loss of bone. The synovial membrane is very inflamed. It creates a lot more synovial fluid, so you see swelling of the joints. And then the cartilage in between is eroding. And remember, eventually you could see the two bones fuse together. With osteoarthritis, it's more of a fact that there's no inflammation going on, but the cartilage, the meniscus, if they're there, and so on, just wears away, so that you eventually have bone rubbing on bone. So, quiz time again. Which type of chronic arthritis is the most common? That'd be rheumatoid arthritis, osteoarthritis. That's right, we've got some osteo answers, perfect. Okay, which type of arthritis may lead to eventual fusion of the bones in a joint? So what might cause bone deformities? Would that be RA, rheumatoid arthritis, or OA? Got Jacqueline saying RA, we've got an OA in there, an RA. Okay, so it's actually rheumatoid arthritis that will eventually cause the bones to fuse because the inflammatory response and the scar tissue process just goes overboard and causes remodeling of the bone. Which type of arthritis may cause a swan neck deformity? Perfect, everybody's got that. Rheumatoid arthritis. Great. Which type of arthritis may lead to the bones in the joint rubbing together? Perfect. Mostly everybody's saying OA, and that's true. It is osteoarthritis. Now with rheumatoid, it would eventually do that at some point, but you would normally have a bit of scar tissue in between the bones. Beverly is saying she has a deformed finger from osteo, and I can see that happening too, because you have, when the bone on bone starts happening, you got an inflammatory response, scar tissue will start at that point, but it's not initially started from an inflammatory response. It's initially started from wear and tear, and then the bones slowly coming together as all of the padding and synovial cartilage in between wears away. Okay, spinal issues. So let's start with disc degeneration. You're going to see how some of these things start to tie together eventually. So commonly known as degenerative disc disease, this condition is not really a disease. This is a condition caused by normal wear and tear. The discs between the vertebrae provide cushioning and absorb shock. Over time, the discs lose some of the fluid contained within the healthy disc. This makes them less flexible and thinner, narrowing the space between the adjacent vertebrae. So here we see a nice, healthy, thick disc, and here we see a degenerative disc, which has lost some of the fluid and thinned down. And then you can see where the nerves come out between the facet joints. It's being pinched because there's not as much space between the vertebrae. So symptoms may include pain down the path of the nerve, which exits in the area of the degenerative disc, so the one here in red. This pain may be located in the neck, arms, low back, buttocks, and or legs. Pain is often worse with activity or sitting for long periods of time. So if you have degenerative disc in your neck, then you may have neck pain. You may have it coming down your arm, sometimes into your hand. If it's really bad, you might start dropping keys and so on. If it's in your lumbar spine, which is also quite common, then you can have some low back pain. It can go into the buttocks, can go right down the legs. Sometimes you'll see a drop foot, which is when the nerve supply to the tibialis anterior is no longer working, so your foot, when you walk, you can't pick up your toes anymore, so your foot drags when you're walking, drop foot. So that would be really extreme in this case. So another contributor, spinal osteoporosis, is a condition causing loss of bone mass and density, causing brittleness of bones. This occurs when the resorption of bone outpaces bone deposit. This causes a predisposition to fractures. These fractures commonly occur in the spongy bone of the spine in the vertebrae. When fractures occur in the vertebrae, there will be a loss of height, and with an increasing number of vertebral fractures, eventual deformation of the spine. So let's look at this. I was looking at this earlier, and I was kind of thinking that picture a shoebox, and picture that shoebox just completely full of paper, let's say. So it's nice and firm, and then osteoporotic vertebrae would be starting to remove a lot of that newspaper that's inside that shoebox. And then an osteoporotic compression fracture, step on that shoebox. That's exactly what happens, is that you've lost, and we see here, normal vertebrae, and here's one with osteoporosis. There's just really not much in there. So it's not as strong as it used to be, and literally just the weight of the spine on it, you might just move the wrong way and it crushes. So just picture yourself stepping on a shoebox. That's exactly what it looks like. So if you get enough of these happening in a particular area, so let's say we had a whole bunch of compression fractures in here, combined with degenerative disc, the spine will eventually start to bend forward. So that is quite commonly seen, and it's part of the loss of height that you tend to see in senior citizens as well. Whoops, wrong direction. Sorry about that. So kyphosis. So here again, picture we've had a whole bunch of disc degeneration and spinal fractures happening in here, and the spine starts to bend forward. So a kyphosis is a forward flexion curvature of the thoracic spine. It can be caused by osteoporosis, spinal degeneration, poor posture injury, complications from spinal surgery. And then a dowager hump is a phrase used to describe a thoracic kyphosis, so this curve here, and then a cervical lordosis, giving a hunchback appearance. Now, of course, if you've got a curvature coming forward that is that severe, you're going to have to bring your neck up quite a bit to be able to see. So that would then cause the cervical lordosis. So it would be like an S shape here. Okay. Is disc degeneration most commonly caused by a disease? Excuse me. That's right, everybody's saying no, good job. So it's commonly caused by wear and tear as we age. What condition may eventually cause kyphosis, particularly in women? Victoria's got it, osteoporosis. Yep. Spinal osteoarthritis may also cause it. Yep. Now the thing is with women, osteoporosis is more common, so that's what I threw in the women thing. But with men, it could also, some men do get osteoporosis for sure, just nowhere near as many as women do. But again, men will get the osteoarthritis and they will get the disc degeneration too, for sure. So osteoporosis is what I was going there for, but you're not incorrect with osteoarthritis. What is a dowager hump? Excuse me. Can anyone remember? So curvature of the spine, yeah. Can you think of the main area that would be curved in a dowager hump? Thoracic kyphosis. Jennifer threw that in. Excellent. That's it. Perfect. So thoracic kyphosis, so the forward curve with cervical lordosis. So in order to see, if you picture yourself hunched over, you would need to pull your head up quite a bit to see. So thoracic kyphosis, cervical lordosis. Okay, let's get into eyesight. So I'm going to go into three main issues with eyesight. I'm going to go into cataracts, glaucoma, and macular degeneration. We're going to see what the different views look like with them as well. So a cataract is opacification of the eye's lens or its capsule. This might be caused from a natural thickening of the lens with age or due to a medical issue such as diabetes or hypertension. Other risk factors include a prior eye surgery, smoking, obesity, prolonged use of corticosteroids, UV light exposure, so the sun or tanning bed. And a cataract causes blurred vision, dimming of colors, and poor night vision to begin with. I mean, that's just a basic, broad idea of what it looks like. So here we have, you can just see that normal lens inside the eye. And then you can see the cataract clouded over. And then here it is here. You can see it through the iris. And oftentimes you'll notice it in elderly people, just a gray area in the eye. And then this is what an idea of what it would look like with blurred vision. So it can cause issues with night vision and so on as well. So macular degeneration is the progressive degeneration of the macula of the eye. So we're looking right here. The macula is in the center of the retina and therefore the center of your vision. So it helps you see fine details in this portion of your vision, right in the middle of your line of sight. This can be caused from age and may also have a genetic component. Prevention includes a low cholesterol diet, protecting your eyes from UV exposure, being a non-smoker, and a diet rich in lutein and vitamin C and E. So this one's really common in my family, actually. So normal vision, you can see the tree perfectly, and here the center of your vision is blacked out. So basically, here's the macula at the back of the eye, and then as the vision comes through, it does look a little bit off center here, but it is a little bit more central, so it's affecting the central vision. Now, I do know that there are vitamins and so on that you can take designed specifically to help prevent macular if you have a family history of it, but there is definitely a big genetic component for this one. Now, glaucoma is the opposite. So let's just look back here. Macular degeneration, you don't see the middle. Glaucoma, you see the middle but not the outsides. So glaucoma is damage to the eye's optic nerve due to intraocular eye pressure, which can result in vision loss or blindness if not detected and treated in time. So pressure builds inside the eye when aqueous fluid does not drain properly from the anterior chamber and the fluid builds up. So you should be having fresh fluid being created and the fluid flushing out continuously. So when it can't flush out as quickly as it's being created, your pressure builds up in the eye. So another contributor might be increased blood pressure. And while you might have an increase of pressure within the eye, not everyone will develop glaucoma. So this just depends on how much pressure your optic nerve can tolerate, and this really varies between people. Glaucoma might be asymptomatic at first. Symptoms include loss of peripheral vision with eventual loss of central vision if the condition does progress. any vision loss before treatment is unfortunately not restorable. So again, we've got our eye, a nice normal looking eye, and then we've got an idea of pressure being built up, and here's the optic nerve at the back, and it's pressure against that optic nerve. So again, similar to your spine, if you've got pressure on a nerve, it's not going to function properly. This is a very similar idea. It's just pressure coming from fluid within the eye instead. So, which vision impairment might cause this type of blurred view? Cataracts, perfect. Cataracts might cause blurred vision along with dim colors and or poor night vision. So if you think of if your vision is, if it's almost like you've got an onion skin over your eye per se, something that's opaque, but you can get light through it. So it's similar to that. So you're going to have a lot less light coming into the eye. So poor night vision is definitely an issue. Which condition is caused by increased pressure on the optic nerve? Perfect, glaucoma. Excellent listeners, everyone. What's the purpose of the macula? What does the macula help you see? Central sight, Joanne says. Fine details in the middle. Perfect. Excuse me. This helps you to see fine details in the center of your line of vision. Perfect. Good job. Okay, urinary issues. Okay, so urinary incontinence is the leakage of urine due to loss of bladder control. This has a huge impact on quality of life because it affects daily activities. So some possible contributors: stress incontinence, urge incontinence, overflow incontinence. We're going to get into each of those in a moment. Urinary tract infections, obstruction, neurological disorders, prostate issues, pregnancy, childbirth, menopause, and age. And a lot of these bottom 6 will fall into one of those 3 categories of incontinence. So, stress incontinence. This is something really common in women. So 24 to 45% of women over 30 have this. Childbirth, pregnancy, and age really does contribute to this in women. So weakening of the pelvic floor muscles. Leakage might be caused by sneezing, laughing, bending, or sexual activity. Leakage can range from just a few drops to a tablespoon, perhaps more. Mixed incontinence occurs when both urge and stress incontinence occur at the same time. So if you hear in a report they say mixed incontinence, we're talking about more than one of these types of incontinence. Urge incontinence is different. It's an overactive detrusor muscle rather than weak pelvic floor muscles. And this is when leakage occurs with a sudden strong need to urinate and you just can't hold it in. So frequent urination and nighttime urination are really common with this. And it might be due to a bladder infection, any sort of irritation in the bladder. So any inflammation, infection, a neurological disorder which inhibits control of those bladder contractions is another cause of urge incontinence. And then we have overflow incontinence. So this is the involuntary release of urine from an overly full bladder, often without an urge to urinate. So if your bladder gets really, really full and you can't even tell that you need to go, there might be some leakage. This could be due to a blockage. So if you think about an enlarged prostate blocking the urine from exiting the bladder, uterine fibroids can do the same thing, urethral narrowing. Due to weakened detrusor muscle as well, because it's the muscle which expels the urine, and it might be a side effect of certain medications. So those are the 3 main ones. Stress incontinence is weak pelvic floor muscles. That's usually, a cough or a sneeze. Urge incontinence is the, oh my goodness, I need to go. You have an overactive detrusor muscle. Overflow incontinence is when your bladder is really, really full. You can't always even tell you need to go, and then there's leakage. So here we have a diagram. So the overflow shows a very full bladder and there's something that is constricting the urethra. So there's some leakage of the bladder here and they might not even know that they need to go to the bathroom and there's leakage. the stress incontinence. So your pelvic floor muscles are relaxed or weakened, and then you have some sort of increase in the abdominal pressure pushing on the bladder. So a sneeze, a laugh, any of those things, lifting something maybe, and then there's leakage. And then the urge incontinence is your bladder is just, the signals coming to the bladder are overactive, and then there's leakage that way. So you can't hold it in. And you may not even have a full bladder, but you feel like you need to go. Whoop, wrong direction again. Okay. So name one of the types of incontinence, the three main ones. What's one of them? Yep, stress. Everybody says stress. Urge. Yep, perfect. Stress, urge, and overflow. There we go. Good job. Which type of incontinence might be caused by a sneeze? Stress. Perfect. All the women are all too familiar. Which type of incontinence may be caused by a neurological disorder? So lots of people saying urge and then overflow. That's right. Could be urge or overflow in this case. Good job, everybody. Okay, balance and falls. So here's some common reasons that you might have issues with these. So decreased physical activity, which is a lack of muscle tone, decreased bone mass, decreased flexibility. So if you think about it, you've lost strength, you're not as flexible as you used to be. So if you start to lose balance, you can't just get it, right yourself again. Medications can cause issues with balance. So sedatives, antidepressants, antipsychotics, they can really cause issues. Vision problems. So if you're unable to see a trip hazard ahead of you, if you have poor depth perception, blurred vision, etc., you might not see what's coming and then fall. Other health conditions, so Parkinson's, Alzheimer's, arthritis, multiple sclerosis, a lot of different issues that can cause problems and cause falls. And then environmental is related into the vision problems. So if you've got trip hazards around, like throw rugs are a huge one, say there's an electrical cord that you have to walk over or around, you could trip on that. Poor lighting, lack of handrails or safety equipment in the house, or not using the safety equipment that you have if you might have a stubborn family member, or maybe not even using it properly. You might be using it but not using it correctly. So these are all things that can cause falls. So leaves are supposed to fall, but people aren't. So what are some ways we can try to avoid falls? So have regular checkups for your eyes, medications, and health conditions so we can try to keep things in check. Physical activity, you want to work on strength, coordination, and balance in a safe manner. So you might need to get doctor's approval. You may need to be under supervision of a physiotherapist, but again, you want to try to stay active and keep your strength up. You can install safety equipment such as grab bars, a raised toilet seat, non-slip mats, shower chairs, transfer chairs, etc. Use canes or walkers properly and any of the safety equipment properly. Make sure they're fitted correctly if you're using a cane or a walker and that you know how to use them properly. I have actually seen former clients of mine, for those of you that don't know, I was a massage therapist for many years, who had a cane and they were using it in line with the wrong foot. So they should have been using it with the opposite leg coming forward. So it was complete backwards to how they should have been using it. So I sent them back to their physio to get that fixed up. So you want to clear clutter and loose objects around the house. You want to remove any throw rugs. Use non-slip mats where you do need them, like in the shower, maybe in front of the toilet. Something rubber that's not going to slide when you go to step on it or trip over the edge of it. You want to ensure pathways are well lit and clear. If you have glasses that are needed, then make sure you wear them. You want to make sure the stairs are sturdy and have proper handrails on them. And something I was reading that's a good point is you might want to look into extending that handrail like another foot or so past the stairs so that once you're down into the landing, you still have something to hold on to while you get your balance, get your feet underneath you when you hit that solid ground. It's a really good idea. You want to have a bed that's easy to get in and out of, and make sure that there's a light within reach beside the bed. So if you have to get up in the middle of the night, you can turn that on and see where you're going. Wear proper fitting non-slip footwear. I know a lot of this seems really basic, but you'd be really surprised about how many don't follow these things. So they are important. Keeping commonly used kitchen supplies stored where you can reach them so that you're not having to get up on your tippy toes trying to reach something in a cupboard. Excuse me, anything heavy you'd want to have lower down, so again, you're not trying to reach up and hold something heavy over your head while you put it down on the counter, and also avoiding having to get up on a step stool. So anything you use a lot or that's heavy should be lower where you can get at it. If you need to use a step stool, make sure it's steady. I do know someone that has had a step stool in the family for probably 70 years, and that thing is so rickety I won't get on it. So make sure there's a stool that is nicely, fairly new and in good shape and good and steady. You want to get up slowly from a seated or a lying position so that you don't get dizzy. The orthostatic hypotension can cause presyncope, which is feeling of dizziness coming on. So I'm sure a lot of you have gotten up too quickly and felt dizzy for a moment. That's really common. So that's just another thing, is just to remember to get up slowly. So name 2 reasons why a senior may be more prone to falls. Just a couple of reasons why a senior might fall. Excuse me. Lack of muscle tone, eyesight, lack of activity. Perfect. So medications, less muscle tone, bone mass, great. Name an environmental hazard which might cause a fall. Junk laying around. I love it, Sandra. You guys are right on the ball. Yep. Throw rugs, poor lighting, cords. Excellent. Can anybody think of anything I didn't mention? Pets. There you go. Yep, if you've got a dog that's not trained to get out of the way. Well, wet floors, that's right. So if you spill something, you want to try to get it cleaned up as quickly as you can. Yep. Cats seem to try and trip you. Yep. I did train my dog early on. If I say back up, she gets out of the road and walks backwards. I did that because I'm pretty clumsy. So what might you change in your home to help prevent falls? So we've got cleaning up, no slip mat in the shower, install safety equipment, kitchen cupboard, so putting stuff where you can reach it. Jennifer says crap. So I'm assuming, yes, crap away. There you go. Good step stool, says Cheryl. Good. Excellent. So these are really important. I can say in all my years as a massage therapist, I can't count how many people fell because of one of these things, and not even just seniors. But so these are really important things to try to take care of in your house. So, okay. Sleep, just as Sandra says, night lights, and that's good. Yes, night lights are very helpful. And you can get some good LED ones now that are motion activated, so they would be a good one to have in the hallway. Okay, so for sleep, in general, this is not everybody, but in general, the senior population sleeps less. They don't sleep as deeply. They tend to wake up more often in the night, and they feel sleepy during the day because they're not sleeping well during the night. So specific neurons in the brain that are responsible for sleep regulation may die off with age, causing sleep disturbances. The more these cells that are lost, the more difficulty you'll experience with sleep. And this is just a natural aging process, and it does affect the circadian rhythm as well. Jennifer saying, or maybe you never had those neurons, so I think Jennifer doesn't sleep very well. I'm sorry to hear that. Poor sleep habits. So keeping irregular hours, consuming alcohol or caffeine, or smoking before bed, and sleeping during the day are all things that can really affect your nighttime sleep. So maybe Jennifer will get some tips in this little section how to improve her sleep. So medications that you might be on, they might make it hard to fall asleep or stay asleep. So I can think of certain anti-anxiety or antidepressant medications that if you take them at the wrong time of day can really affect the way that you sleep. There's a lot of different ones. If doctors really specifically say take this in the morning, you know, it might be one that if you took it at night, you'd be wide awake for the nighttime. So that's really important to take note of in your prescriptions. Stress might keep you awake, so lying awake thinking about different worries, of course, we're all familiar with that. Lack of exercise, so regular physical activity helps improve the sleep. Physical discomfort in bed, so you might be someone who's thinner and has, you know, more bones that are a little closer to the surface, not as much padding, we'll say. So, you know, you might want to get a foam cover for your bed. You can get sheepskin to lay on. That's something my grandfather did. You know, look into getting more comfortable bedding so that you can be comfortable in the bed. Okay, so here's the tips for Jennifer. Have a regular bedtime if possible. You want to exercise regularly. Avoid caffeine, alcohol, or smoking before bed. Avoid long or frequent naps during the day. You want to have your medications regulated. So if you're not sleeping, you might want to go to the doctor and ask if any of your prescriptions might be the cause of that. You want to have regular checkups to monitor any possible underlying health issues that might affect your sleep quality. Establish a pre-sleep ritual. So maybe you want to have a bath and read before bed or something like that. It did talk about having a light snack and so on. So if you eat too much before bed too, that can keep you awake. So it also mentioned try not to eat 4 or 5 hours before you want to go to bed because your digestive system is kicked into gear and that can keep you awake. So something to consider if you tend to be a late night snacker. Joanne is saying deep breathing for 5 minutes before bed helps relax as well. Yep, here we go. Practice relaxation techniques such as breathing exercises to promote sleep. Even just things like breathe in for 4, hold it for 4, out for 4, hold it for 4, in for 4, the box breathing. There's different things, or you might even just want to count how many seconds you breathe in, count how many seconds you breathe out, just something to get your brain focused on your breath rather than anything else that might be on your mind. So Cheryl says guided meditation on her phone helps. Yeah, I do the same thing. When I can't sleep, I have an app on my cell phone for a guided meditation. I try to find one that I find relaxing. If it has weird music or bells or something that disturb me, then I will find another one because it will just keep me awake. So there's different things you can do. Sandra's saying she's the opposite. When she eats, she needs to lay down. So something to keep in mind. But if you're having trouble sleeping and you do tend to be someone who eats a lot at bed, you know, you might want to try not eating as late. Okay, do most seniors sleep more or less as they age? Yes, everybody's saying less, that's right. Now my mother would be the opposite of that. She sleeps till noon like a teenager. Name a cause for poor quality sleep. Medication, naps, so naps during the day, stress, neurons dying off, stress, napping. Perfect. So what might someone do to improve their quality of sleep? Jennifer, exercise, yep. No napping, so yep, or not as long napping. You might want to set an alarm for yourself, a better mattress, avoiding long naps and caffeine, breathing, meditation, no smoking, exercise. Yep, even just getting outside for fresh air can help too. I didn't mention that earlier, but regular bedtimes, no alcohol. That's right. Perfect. Okay, so chronic obstructive pulmonary disease. I threw this in at the end because a lot of seniors have respiratory issues, so I thought we better go over it quickly. So your lung function decreases with age. Chronic obstructive lung disease is the most common respiratory disorder in senior citizens. And then the following table goes over a little bit of the respiratory changes. So the ones I thought were most important: the airway reactivity is increased. So if your lungs are irritated, your bronchioles might constrict, making it harder to get air in and out. Chest wall compliance. So the flexibility of your chest wall and even your lungs becomes more stiff as you age. It's harder to get that deep breath in there. The oxygen uptake by your body decreases, so you're having a lot less saturation, a lot less oxygen in the body, so you're short of breath and tired a lot more often. And then the muscle strength of the respiratory system and the endurance is lowered. So these are all things that really contribute to being short of breath, having troubles breathing. Some of the risk factors for COPD include smoking history, prior exposure to occupational hazards. So some of the ones I thought might be more common would be coal dust. So if someone was a miner in the past or lived near a mine, silica and glass, asbestos. There was a lot of asbestos exposure in the past. Grain dust if you're a farmer. And you got to think too, back then we didn't think there was anything wrong with those things. It wasn't until later we realized that they were a problem. So a lot of people who were exposed to those in their work or even just in life could have issues with their respiratory system. Males are more prone to it than females, and family history does come into play. So there's a genetic component to it as well that makes you predisposed to COPD. So signs and symptoms. Okay, so there seem to be two main contributory issues that were other respiratory issues that you might have first. So if you had emphysema, then there's a destruction of the alveoli. Deborah is asking if this will be posted. It will be posted probably later today or tomorrow, Deborah. So with emphysema, your alveoli are destroyed. Your alveoli are what does the oxygen exchange with your blood. So there's a definite decrease in the amount of oxygen in your blood if emphysema is the problem. Oh, decreased elasticity of lung tissue, so less lung recoil due to breakdown in elastin in the connective tissue. So your lungs and your chest wall are going to become a lot less flexible, so it's a lot harder to get a deep breath in. A chronic cough, so you might have sputum production or not, and dyspnea, which is shortness of breath. Again, so if you have shortness of breath, that becomes a lot worse with activity. Feeling of chest tightness, airflow obstruction, or air trapping. So airflow obstruction could be if your bronchioles dilated, or sorry, contracted, so you can't get as much air in or out. Air trapping is when you have air that's caught in the lung and you can't get it out. So if you were to try to do a breathing exercise and not exhale all the way and then try to breathe from there, it's very difficult. It does make you feel very short of breath and sometimes a bit anxious. So imagine having that all the time where you can't get all the air emptied out of your lungs. That is what they mean by air trapping. So again, emphysema was one of the contributing conditions, but chronic bronchitis is another. So in this, you have inflammation of the bronchioles, the bronchi, and it limits airflow because when that tube is inflamed, the swelling causes less room for air to come in and out. This is a progressive disease. It leads to hypoxemia and hypoventilation, so not enough air in the body and more shallow breaths. And then eventual respiratory failure can occur. It's actually one of the most common causes of death in the world is respiratory disorders. So let's see here. Name a risk factor for developing COPD. Smoking, yes, this is like a big anti-smoking ad, this entire presentation. Grain dust, yep. Male gender, you guys are good. Family history, excellent. Asbestos, yep. Yep, okay. So smoking, occupational hazard exposure, male gender, family history, yep. And I can tell you, as a family member who worked in the company that worked with asbestos, is the company actually used to give out rolls of asbestos to their employees if they wanted to use it as insulation in your attic. Can you imagine? So that is how completely oblivious we were back then. So a lot of people in this area buy new homes and end up having to get people in, specialists to come in and take the asbestos out of their attics. So not even just in tiles and flooring, people around here might have an attic full of it. So yeah, if you're ever doing anything in your house and you find tile, linoleum flooring, anything like that, that you think might have asbestos in it, just stop work, because as soon as you disturb it, that's when it's going to get into the air and can go through your whole house just through your ventilation system. So if you think you've got it, just stop what you're doing and call in the experts to have it checked. Number 2, name 3 common symptoms of COPD, chronic obstructive pulmonary disease. Well, it may be a sign or a symptom of that. Airway reactivity, chronic cough, chest tightness, shortness of breath, dyspnea, perfect. Cough, yep. Good job. So I just named a few of them: coughing, sputum production, shortness of breath, chest tightness. So you guys have done a great job. Do the lungs become more flexible or less flexible in a patient with COPD? Less. Oh, got one more. Less, less, less. Yep. So you have a decrease in elastin on the cellular level, and so you lose the flexibility. Think of an elastic that's really, really old. That when you go to pull it, it kind of breaks a part of it. That's sort of a similar idea. So yeah, the lungs become less flexible as elastin is decreased. Okay, so in summary, I saw a lot of repetitive ideas in my research on how we can best prevent disease and health decline as we enter our golden years. Leading a healthy and active lifestyle, including eating well, not smoking, managing stress as best we can make a big difference in our quality of life, not only now, but in the years to come. So regular healthcare checkups to monitor general health, medications, and eyesight are beneficial to catch issues and provide treatment early on. So think of taking action now as an investment in your future. So thank you for joining us today.